A very warm welcome to Chatham House, and welcome especially if you're joining us today via Zoom or via Facebook Live. My name is Renata Dwan. I'm the Deputy Director here at Chatham House, and it's my honor to welcome you to our discussion today on Nigeria's post-COVID priorities. Nigeria, Africa's most populous country, has set an ambitious target of lifting 100 million citizens out of poverty by 2030. But as the impact of the COVID pandemic extends, it has significant challenges to achieving that goal. Expected GDP growth in 2021 is 1.5% and is compounding the challenge of the steep decline of oil prices last year. The past year has also seen the widening and deepening of insecurity across the country and the challenges to Nigeria's goals in building an effective and accountable security sector that protects citizens from the increasing range of terrorist, banditry, kidnapping, as well as intercommunal violence they face. To discuss the complex challenges facing Nigeria and how the government can bring about the structural changes that sustainable social and economic development requires, we're deeply honored to be joined today by the Vice President of the Federal Republic of Nigeria, Professor Yemi Osinbajo. Vice President Yemi is an accomplished scholar and lawyer and one of the nation's leading experts on public law and national and regional corporate and commercial law. As Attorney General and Commissioner for Justice of Lagos State, Professor Yemi undertook significant judicial reforms to ensure access to justice for the poor. He also co-founded Integrity Nigeria, a non-governmental organization dedicated to promoting anti-corruption and good governance. I should also note that he is also an ordained pastor of the Redeemed Christian Church of God in Lagos. So a warm welcome to you, Vice President. We're delighted to have you with us today. Just before we turn to you, Your Excellency, let me just flag that our discussion today is on the record and is being broadcast on Facebook Live. We want to make this discussion as interactive as possible. So please, after the Vice President's address, if you wish to raise a comment or a question, please use the raise hand function during the Q&A, and we'll call on you to ask your question live. We may not get to all of you, but we will try to certainly ensure that we have a wide range of participation. For those of you who'd rather not take the floor or who have a bad Zoom connection, feel free to submit written questions through the Q&A box throughout the meeting. As a final note, please note filming and recording of this event are not allowed without prior permission from Chatham House, but you're more than welcome to tweet the event using the hashtag #CHAfrica. So without further ado, it's my pleasure to turn to you, Professor Yemi, and to hear from you, Nigeria's priorities for the post-COVID era. The floor is yours, sir.
Thank you. Thank you very much, the chair of this meeting, Renata Dwan, and all our friends and colleagues, participants in this webinar. I'm delighted to be here to participate in this very important ongoing global conversation and to, fit Nigeria's own priorities for our post-COVID-19 recovery into the global context of post-COVID recovery. There's no question at all that the devastation wrought by the COVID-19 pandemic on business, on production, on learning, on travel, and on practically every facet of life has set us all back, tremendously. But at the same time, it has also created incredible opportunities. And there are certain areas I'll be focusing on about four or five areas, beginning with public health and how in the area of public health and generally healthcare, we intend to respond and build on what we've learned in the past 1 year. As with other nations, the pandemic tested the integrity of our systems. And in charting our way forward and designing our nation's post-pandemic future, especially in the health area, we are clearly building on, we're clearly going to be building on some of the experiences that we've had so far. Now, what we did beginning in about April or May was to develop an economic sustainability plan, a short-term strategy formulated to address the twofold challenge posed by the plague to both public health and the national economy. So in practical terms, this meant creating resilience in the health sector to ensure that we could respond to crises like this in the future, as well as saving and creating new jobs by stimulating local production across several sectors. So I'll be talking, about our public health response as well as, of course, the economy, and we'll be talking again about some other areas, including climate change and energy security, etc. But the economic sustainability plan was, as I said, our short-term plan for being able to respond to the crisis, but we also realized that it will be a bridge to some of what we intended to do in the future. The first recorded case of COVID-19 was for us in February 20th was, yes. And what happened immediately, again, pointed to some of the areas of our public health system that we could actually build on. So when that patient was identified, a sample of the virus was sent to Africa's Center of Excellence for Genomics and Infectious Diseases at the Redeemers University in Osun State, Nigeria. There, a team led by Professor Christian Happy analyzed the sample, and they were able to, within 48 hours, share the very first genome sequence of the severe acute respiratory syndrome coronavirus 2 from Africa with the global science community. Now, the speed with which the test samples were analyzed helped us calibrate the measures that we thought would be necessary to curb the spread of the pandemic. But the interesting point here was that we had some capacity to be able to at least, quickly put together the genomic sequence of the disease. But that capacity had always been ignored until this arose. Yes, there was a bit of work done on Ebola and all of that, but we had practically ignored this. So one of the critical areas for us going forward, obviously, is in doing far more with our research institutions and investing far more in our research institutions. And I think I might say a few things about that as we go on. But since February 2020, we've significantly ramped up our testing and case management capacity. We've activated from about 5 molecular laboratories to about 120 molecular laboratories, most of them public laboratories. We've expanded the footprint of our sovereign public health response capabilities, especially at the subnational level, and in areas where such capabilities simply didn't exist before. But going forward, we are committed to building on the exemplary dedication of our health workers and strengthening the capacity of our health system to withstand shocks created by infectious diseases and pandemics such as we experienced. So in this regard, we are promoting a culture of preparedness across all levels of our healthcare sector. And one reason why we've been able to manage this pandemic, I think, better than expected, is that we did have some existing public sector infrastructure to work with. So the Ebola outbreak of 2014, our ongoing battles with Lassa fever, our successes with polio eradication, helped us to tighten our epidemic contingency plans, strengthen our emergency coordination and surveillance capacities, and also helped us, and also, of course, enhanced investments in public health laboratories. So one of the key lessons that we learned from our response to the Ebola outbreak was the need to build systems in peacetime, if you like, that can be used during outbreaks of this kind. Our National Center for Disease Control, the Nigeria Center for Disease Control, which was founded in 2011, was made independent in 2018 as we prioritize the strengthening of our public health infrastructure. But while it's true that in many respects, hospital infrastructure still lags behind the standards, especially in richer countries of the world, we've been able to draw on the resilience and adaptability of our tried and tested community health systems. So for example, we were able to very quickly repurpose the teams that had been deployed to communities to vaccinate children against polio, to conduct enlightenment campaigns in communities about the new pandemic. The pandemic has asked tough questions of our national capabilities, as I said, in the area of research and innovation. And I must say that we responded quite gamely to these issues. Last December, the Nigerian Institute of Medical Research launched a new set of COVID-19 test kits that could produce results in 57 minutes. The new kit was designed by Joseph Shaibu, a molecular virologist at the NIMR. By the end of the year, the Center of Excellence in Osun State, which was the first to sequence the genome of the SARS-CoV-2, will inaugurate the biggest genomics research center in Africa. And earlier this year, the center was selected by the Broad Institute of the MIT and Harvard University to be part of a prestigious scientific coalition that will help set up an early warning system to prevent and respond to future outbreaks and pandemics. So we're prioritizing local research and development and investing in the efforts of our scientists and innovators to develop solutions in pharmaceuticals and medical consumables. Of course, to support this, the government set up the Healthcare Sector Intervention Fund, which is about $185 million disbursement to finance the acquisition and installation of critical medical equipment. And we also have a $609 million disbursement also to this is to the health sector in particular for generic production of generic drugs, and also development of our vaccine production capacity. So there are quite a few developments which we think as a result of our experiences in the past year. And I think that in particular, the research efforts have benefited greatly from this, from the aftermath of the pandemic. So I just want to mention, as just to close this bit about public health, the need for vaccine multilateralism. As part of our recovery efforts, Nigeria has taken delivery of about 4 million doses of the COVID-19 vaccines under the international COVAX scheme. And we commenced the vaccination of our people. This year, we'll receive 84 million doses of the Oxford AstraZeneca vaccine under that same scheme, which will be enough to vaccinate about 20% of our population. However, these efforts and those of other African countries are proceeding under the specter of vaccine nationalism. And there are justifiable concerns, in my view, about the certainty of fair and equitable access to vaccines, as well as the likelihood that poorer countries may be left behind if the distribution of these vaccines is determined by the nationalistic sentiments that we're seeing all over the place at the moment. We must be particularly concerned about the secularization of global health, that tendency to conflate global public health with national security and geopolitical calculations at the expense of the multilateral collaboration required to worldwide vaccine coverage. So I think that in our globalized environment, national self-interest alone is insufficient to address the challenge of a global pandemic. Indeed, in a world as interconnected as ours has become, anything that is any plan other than a global plan is bound to be counterproductive. So I'll just go quickly to the economy and some of what we've done, especially first response to the pandemic and to the fallouts of the pandemic. So our first priority, of course, was to protect people and their livelihoods. And about 50% of our economy is driven by the MSME sector. And one of the specific interventions under the Economic Sustainability Plan was what we described as a survival fund, which essentially was a fund to protect jobs and to ensure that during the course of the pandemic and immediately thereafter, informal workers in particular, or private sector workers, especially those in the informal sector, were at least able to continue to earn some wages. So through this initiative, we're able to support in the first phase over 300,000 businesses by providing salaries for 3 months for beneficiaries. Now, the beneficiaries included private school teachers. Now they're, and the reason, of course, is that public school teachers continue to earn salaries even during the lockdowns. But private school teachers obviously were not as fortunate. So government supported private school teachers, road transporters also, taxis, especially commercial tricycle operators in the urban areas. They also came under the survival fund scheme for a 3-month period. We also sought to protect the most vulnerable, in particular the urban poor, who also, of course, were very hard hit. So what we did was to provide direct cash transfers to the urban poor, under many of them who are in our social register. Now, the first phase of that, we were able to benefit about 1 million beneficiaries. And we're now in a position, using the same social register, to scale up the program to about 20 million beneficiaries. In addition to this, we also focused on underpinning infrastructure to provide a multiplier effect for resilience in the future. We found that to reach people, to provide support, to keep the economy open and people at work, we needed to have certain things in place, especially data. So we accelerated our broadband program, our broadband connectivity program, by reducing the cost of laying broadband infrastructure and extending penetration to unserved and underserved areas. So the plan is to deliver data download speeds across the country of a minimum of 25 Mbps in urban areas and 10 Mbps in rural areas, with an effective coverage available to at least 90% of the population. Our projection was by 2025, but with some of the work that's already been done, we expect that we could actually conclude by 2023, and at a price of not more than 390 Naira per 1 gigabyte of data, which is 1% of the minimum wage and 2% of median income. So we've recorded the mileage increase of fiber optic cabling from about 47,000 kilometers now to just under 55,000 kilometers, representing a 10% increase over a 1-year period. So really, the pandemic, I think, was instrumental in our being able to move faster on our broadband connectivity program. The other program which we've worked on is also the National Identification Program. So we've expanded the provision of national identification numbers by partnering with telecoms companies. Our aim is to issue national identification numbers to every Nigerian. And our target is by the end of 2022. So far, we've covered about 56 million. And we expect that we should be able to conclude this by the end of next year. These measures will ensure that all parts of the country would have access to affordable data for both remote working and learning, and also, of course, for all of the business opportunities that that broadband connectivity would, of course, encourage. Expanding our national identity base, of course, will also help us to identify those in need. And this, of course, will help in the development of our social register and so many other pro-poor programs under our social investment scheme. To stimulate production in the economy, we focused on energizing existing value chains in agriculture, in construction, and renewable energy. Our agriculture program, and I'm talking still about the economic sustainability plan, which is, as I said, the short-term plan, the post-COVID, during COVID and the post-COVID short-term plan. Our agriculture program aims at expanding productivity, creating in total about 5 million jobs. What we've done so far is that we've been able to register and geotag about 5 million new farmers to farmland areas. And the idea, of course, is also to increase land under cultivation from a combination of aggregated smallholder farms and the integration of previously underutilized farm settlements. The program is supporting smallholder farmers by linking them to extension services and low interest input financing. Aside from agriculture, we have a mass housing program, which is designed to deliver affordable homes through direct intervention in the housing construction sector, aimed at creating 1.8 million jobs, together with the construction of 300,000 homes in the first phase. Now, this is a social housing scheme, and one of the priorities for us is that anyone who earns the minimum wage and who is able to spend a third of his, or who's ready to expend a third of that wage on housing should be able to afford a home. So at the moment we have programs going on in 12 states. We extend to expand to all of the states of the Federation. We've been able to build and develop a home which costs just under 2 million naira. I'm not entirely certain what that comes to in pounds, but I'm sure that in dollars, I think that would be about 4,000, I think, or $5,000, something like $5,000, yes. So that's for the social housing scheme. Well, medium and to long-term outlook going forward, our priorities are to restore economic growth in the immediate term, and in the medium term to reposition the economy on a sustainable footing. Our goal is to seize the post-COVID moment, not only to save jobs, but to make the country a hub for local production, especially light manufacturing, shoes, steel fabrication, ceramics, plastics, furniture, and building materials. Even as we build domestic capacity, we're doing so in the knowledge that our true horizon is outward. So a policy imperative is the encouragement of value addition and beneficiation in every sector of the economy, especially to consolidate the areas of our comparative advantage. So manufacturing, as I've said, particularly light manufacturing, holds considerable promise. And we are looking also at mining, where we think beneficiation will provide tremendous opportunity. one of the ways by which we've tried to approach enhancing manufacturing is the establishment of special economic zones. Of course, we have some already, but we're now looking at establishing 6 new special economic zones. And most of these zones, well, of course, these zones will be well provisioned with power and infrastructure. And already we have one that will take off, we hope, by the end of the year. That's the Lekki Economic Zone. And there are 2 others that are in that we expect should take off also at the very latest by the last quarter of this year. Recently, the president approved a 50 billion export expansion facility as part of the economic sustainability plan to provide support for exporters, particularly MSMEs. So our priorities here really include assisting a lot of the small companies that are doing incredible work, especially in food processing and packaging, and in leather works, garment manufacturing, etc., in being able to export some of their products.
Thank you so much, Vice President. I'm going to ask you, if I may, to wrap up in the next few minutes, because I can see there's really interest in some of the following up on some of your great points.
Okay, maybe I should just stop here so that we can then, take the questions, and then I could develop this as I go along. Yeah.
No, thank you so much. And thanks for providing such an expansive engagement across so many floors of questions. I know there's going to be lots of questions and lots of interest, given that you've raised so many great points. And I'm going to turn now to questions, if I may, Professor Yemi, not least because I know that one of my colleagues, Rob Yates, head of our Global Health Program, is going to be very interested in asking you about some of your opening comments on the great work that you've undertaken to tackle the pandemic. So Rob, I'm going to turn to you first, and then I'm going to move to colleagues who put up their hands. So thank you.
Many thanks indeed, Renata, and thank you so much, Your Excellency. I'm delighted to hear you give such a high prominence to health in rebuilding after COVID-19. I was just wondering one specific thing that we've seen through history, that many countries coming out of crises have launched publicly financed universal health reforms. One thinks of the UK, France, and Japan after the Second World War, Thailand after the Asian financial crisis, and even Rwanda after the genocide. This makes perfect sense because it brings quick health benefits to the population, economic benefits, and dare I say it, political benefits to the government because it's so popular. So I'm just wondering, is that a major policy that your government is maybe considering coming out of the COVID crisis?
Can I suggest, Vice President, that I take one more question and then I take a few if you're comfortable with that, Professor. So let me invite next Olai Olanrawaju to take the floor, and forgive me if I've mispronounced your name. Olai.
Thank you so much, Your Excellency, Professor Osinbajo, for your presentation. We know that data reporting is very, very key as regards service delivery and COVID-19 issues, as we have seen here in the UK. Are you aware of the total number of COVID-19 related deaths in Nigeria? Put simply, what is the total number of COVID-19 related deaths and how many Nigerians have been vaccinated so far? And then, secondly, right now, in terms of your presentation, you said that the pandemic tested the integrity of our system at the beginning of your presentation. What are some of the lessons learned from COVID-19 pandemic spread in Nigeria, aside from scaling up the number of laboratories? Thank you so much, Your Excellency. And this is Olanrewaju Olaoye from the University of Lincoln, UK. Thank you.
Thank you so much, and thank you for introducing yourself. Professor Yemi, Vice President Osinbajo, I'm going to ask you if you'd like to answer those 2 questions.
Thank you very much indeed. I think that first, I think it was Robert who asked about the universal, about the possibilities for universal health insurance and all that. Yes, certainly we intend to take this opportunity, and this had started just prior to the COVID-19 pandemic, the National Health Insurance Fund. Now, we do have a National Health Insurance Fund. The problem, of course, is that it's not mandatory. It's not mandatory for Nigerians to be a part of that National Health Insurance Fund. In other words, it's not compulsory. Now, what we're doing now, there's currently legislation which we hope will make it mandatory and compel each state. Many of the states at the moment, some of the states at the moment have their own National Health Insurance Fund, but we want to collapse as many of these as possible into a National Health Insurance Fund. Now, the National Health Insurance Fund is one which we hope will pool the resources to really enable healthcare, funding. At the moment, healthcare is funded almost entirely from budget. That's the budget of federal government and the budget of the states. As you know, we have a federation, so we don't have we don't have a national healthcare budget. Every state has its own healthcare budget, and the federal government has its healthcare budget. The states are responsible for primary healthcare and some parts of intermediate healthcare. But what we hope we can achieve with the National Health Insurance Scheme is to be able to bring everyone under one scheme and to make it mandatory. But that would also mean that government would have to provide premiums for the very poor initially. So some of what we're looking at is how government can provide 40% of the funding, so that those who simply cannot afford to pay their premiums are paid for by the government. But a lot of stuff is coming together because our national identification programs and all of that are helping us not only to get a better appreciation of who is who, but who is where and all that, and what people can afford and what they cannot afford. So we think that all of this is coming together at a good time. And certainly universal health insurance is something that we're working very hard on. But ahead of that, we have something called the Basic Healthcare Provision Fund. Now, the Basic Healthcare Provision Fund is a fund provided by the federal government for the states of Nigeria. Now, what that means is that depending on the primary healthcare center, we have primary healthcare centers in practically all the states of the Federation. So this Basic Healthcare Fund is provided in each primary healthcare center so that those who really cannot afford healthcare, especially for primary type diseases like malaria, etc., are able to go there and be treated free of charge using that healthcare fund. But obviously, it isn't enough for everyone. But it's in my view, it's a stopgap as we go into a much more detailed national health insurance policy. I think Olarinwaju wanted to know about number of deaths so far. We just have over 2,000. I think as of yesterday, it would have been 2,030 or so. The number, of course, one can get a more accurate number. I think it's just over 2,000. Total confirmed number of cases is about 161,000. Total confirmed number of cases. And total number of those who have been discharged is about 148,000, just a little over 148,000, But of course, we could get you more to the minute information from even open sources anyway. But the total number that have been vaccinated so far is just over 122,000. 122,000 people have been vaccinated so far. Right.
Thank you so much, Vice President. I'm going to move now to the next group of 3 speakers, and I'm going to ask you if you can introduce yourself as you take the floor, just so that the Vice President knows who he's talking to. The first doesn't need an introduction, Katrina Lang, British High Commissioner in Nigeria, so no stranger to you.
Hello, Vice President. Very nice to see you on Zoom. Just one quick comment and then a question. My comment is I'm really excited to hear about the amazing progress and the capacity on genomic sequencing and so on. As you know, VP, we've had a very good collaboration with Public Health England over many years. So I think going forward, this is a really fruitful area for UK-Nigeria collaboration, building on the foundation we've already got, research to research, academic links, particularly in the health sector. So just to comment, really strongly welcome that. My question is on policy reform. There's no shortage of interest from investors in Nigeria. The size of the market alone makes it a very exciting place. But as you'll be aware, there are some real concerns about the policy environment, particularly at the moment, the foreign exchange issue. And to be honest, I think that's what, above everything else, that would unlock the foreign investment in particular that would really help Nigeria take off. So if you could say a word on policy reform, that would be very helpful. Thanks, over.
Thank you very much, Katrina. Now I'm going to pass on to Rotimi Jayashimi. Rotimi. Can you hear me, Rotimi? Can you hear me? Okay, we have a little bit of difficulty there with Rotimi, so perhaps we'll pass on to our third speaker, Ignatius Oli. Ignatius, the floor is yours.
Thank you very much, Renita. Your Excellency, it's a very wonderful opportunity to be in this forum with you. My name is Ignatius Oli, and I'm the founding president of the Institute for Sustainable Education and Development in Germany. Your Excellency, you've spoken so much about broadband data and increase in penetration. I was just wondering if you could highlight a little bit more about investing in research institutions to solve the issues of COVID-19, and how we're going to ensure adequate monitoring for judicial use of most of the fundings that will be provided for such institutions. Also, in terms of partnership with people from the diaspora, we would want to encourage more researches and encourage local people in Nigeria to have better researches. What are you doing towards this? Thank you.
Thank you very much. So 2 questions a little bit related to research and research support, Professor Yemi. Do you want to take those 2 and then I'll move on to some other questions? You're still on mute if you can just, yeah. It always happens.
Yeah, okay. I think the first question was from Katrina on questions around policy reform, especially foreign exchange issues and all of that. Of course, the reason why we've had issues around foreign exchange, especially with businesses being able to remit foreign exchange, being able to remit payments and make payments in foreign exchange recently, has largely been on account of the shortfall in foreign exchange revenues coming from oil. But as you know, that is a matter that the central bank has been working on. And I think the particular policy move that we hope the CBN will undertake as quickly as possible is as much as possible being able to align the exchange rates, being able to unify the exchange rates. And we think that that has started. Of course, in the past week, in the past 2 weeks, we've seen some momentum towards greater unity of the exchange rates. And we think that that would encourage inflow of foreign exchange and make it, because at the moment, there are many who believe that a demand management strategy for foreign exchange is obviously not the best. And so we are all working with the CBN, and we hope that soon a much more supply side type approach will be undertaken. And this comes, I think, first with unifying the exchange rates, which we hope will then improve supply of foreign exchange. And once that happens, we think that things will take, will of course take an upward trajectory. We've seen this before. We've seen this in 2017. We saw it in 2017. We saw this happen in 2017. And I'm confident that it wouldn't last. It wouldn't be long drawn, and that we'll see a change quickly. Now, with respect to research, I think to the question asked by Ignatius, of course, there's a lot of investment. There's a lot of investment in research, as I pointed out, especially in public health research. And there's also quite a bit of investment in pharmaceuticals, the production of pharmaceuticals, direct funding, which I mentioned, for pharmaceutical companies, especially those that are interested in the manufacture of generic drugs, and work that is going on about vaccine production. So I think that our focus is, in the public health sector in particular, is on improving research capacity and by investing in that area. Now, as to the question of how these will be monitored, obviously monitoring and evaluation capacities of the Ministry of Budget and National Planning has been the major form in which, the major way in which monitoring is done. But with respect to some of the funding that we're giving now, I think that because these are essentially privately run enterprises and privately run institutions, we've brought in, to a certain extent, the discipline of the financial sector, because most of it comes through the banking sector, and most of it comes through or through well-established funding agencies that have their own mechanisms for monitoring. So we're reasonably confident that a lot of these funds will be used for the purposes for which they were designed or for which they were dispersed. With respect to diaspora, people in diaspora collaborating with institutions, what I would say is that we have a diaspora commission that is devoted, almost entirely to making sure that these types of arrangements are done well and that they are effective. Ms. Honorable Abike Dabiri has a lot of experience in diaspora relations. She is the executive chair of the Diaspora Commission. And whatever inquiries you may have, especially about the diaspora collaboration, they are able to provide very quick and comprehensive answers. So I think that any person who would like to work especially from the diaspora with Nigerian institutions and national institutions, the Diaspora Commission will be very helpful.
Thank you so much, Vice President. We have a ton of questions and lots in the chat line too. So I'm going to ask those who take the floor, if you could keep your questions brief, please. We'll start with Dr. Aderonke Tomori and then Kamal Kamaluddin. I don't know if we're hearing from Dr. Tamori. Okay, if not, could I suggest we pass on to Kamaluddin, and then we'll go back to Dr. Tamori.
Hello, can you hear me?
Okay, we can hear you now, Dr. Tamori.
Yeah, okay. I heard Adironke Tomori, so I was surprised. My first name is Oyewale Tomori, so that's why I wasn't too sure it was me. Thank you, distinguished Vice President. We always admire you and the work that the government is doing. We see, those of us at home see that this government is doing its best, but there's a little bit of problem of trust. How do people trust the government? Even though you're doing so much, there's still that feeling that, you know, things are not being done, people are not happy. But what steps are we taking to get the people to trust what the government is doing and collaborate with the government? That's my first point. The second one is the issue of diaspora. The problem with diaspora is not the diaspora. The problem is home. If the environment at home is not fine, that's what drove the people to diaspora in the first place. So whether you're coming from diaspora, if you come back to the same environment, you go back to the diaspora again. What are we doing to get the enabling environment for the talent at home to function? My generation functioned in an environment that was conducive. Things are toxic now. What are we doing? Over, sir.
Okay, thank you very much. Oh, are we just going to take the one question?
If I can just call two more people in, if I may. I have Ronnie Adjeo, who has been waiting patiently, Kamaluddin, and Andrew Matheny. So Ronnie, we'll start with you.
Okay, thank you very much. Your Excellency, thank you very much. And it's very impressive to sort of hear the immense amount of work that's currently being done in Nigeria, and we thank you for that. And one of the questions I have is, what is Nigeria's debt, which has increased and currently stands at about 87 billion US dollars. And given the priorities for Nigeria has been defined post-COVID, what's being done to address our external debt? That's question one. The second question, which is tied into that, and I think Catriona alluded to that, is what are we doing to get investors into Nigeria? And also how are we measuring in terms of the population, in terms of the measures that you're currently undertaking? Thank you.
Thank you, Ronnie. Kamaluddin.
Good afternoon, Your Excellency. My name is Kamaluddin, and I live in the UK. And I believe there's been, first of all, I want to say thank you for all your efforts in trying to make sure everybody is fine back home, and also the effort of this administration in facilitating facilitating life for people back home as well. And I know there's been a law about diaspora coming home to invest and contribute to the development of their country. And one of the issues we have is, someone said it, is about trust. And apart from trust, it's also strong institution. For instance, I have applied to CAC, that's Corporate Affairs Commission, since August last year to register a company. And as we speak, there's been a lot of frustration just to get a company registered. And my take is, how can we contribute to the development of Nigeria if we can't even get the basic things right, having a strong institution? And I think you've done a lot. I follow the government. I know you've done a lot in the part of CAC, but I'm not sure if there's any check and balance in order to checkmate these SSAs in order for us to be able to get things done as easy as possible.
Thank you, Kamal. I'm going to ask you, if you can now, that the question, if I understand it, is focusing on red tape and what can be done to make that possible for small companies to interest. If you don't mind, I'm going to move on now to Andrew Matheny, and then I have two questions from the chat box. Andrew.
Thank you very much, Andrew Matheny. I'm an economist at Goldman Sachs. My question pertains to FX policy and follows up on the last one that was asked. And the question is as follows. Finance Minister Ahmed yesterday indicated that the Central Bank of Nigeria would be moving to a flexible exchange rate, would be abandoning the standing pegged official exchange rate. Could you confirm that? And then the second part to the question is if you see the policies in 2017 as a guide to how the government may address the situation in the FX market that we see today, and how quickly could we see progress on this front? Thank you very much.
Thank you very much. And I'll take a final question from the chat boxes, because I'm conscious people have also pursued that path. A question from Uzosike Okwuchi. Can you please, Mr. Vice President, elaborate on your position with regards to the Nigerian government's response to the End SARS protests and evidences of human rights violations that took place, and how do you identify and feel about the government response in that area? We also have a question on the Nigeria's vision of the UK's integrated review that has just come out, and what should be the UK's role in as a trade partner for Nigeria and supporting Nigeria's growth post-COVID. So very many questions, Professor. Don't feel you need to take all of them, but it's evidence of the immense amount of interest and fantastic responses that you've been giving. So over to you. I'll just ask you to unmute if I can.
Yep. Okay, thank you. I'll start with the questions asked by Professor Tomori. Obviously, it's a huge question around the trust deficit that governments experience. I think, to be fair, practically governments everywhere, are not trusted. Politicians are probably the least trustworthy, well, not the least trustworthy, the least trusted people anywhere in the world. So the only way to go about this, and this is what we're doing here, and really making the best efforts we can, is to deliver on our promises. And we must admit that there are several and grave challenges that we have to face and that we must confront. And those challenges, of course, are of various kinds, and they haven't been helped by a year of the kind of turbulence that we experienced with COVID-19. But I think with respect to trust, what we're trying to do is to deliver on what we say that we will do. I think that by and large, our response to the COVID-19 pandemic showed the capacity of government, showed that it is possible for government to do stuff and to do it effectively. The way that we've handled quite a few of these issues, our social investment policy as well, the largest of its kind in sub-Saharan Africa, and is one that we're working hard on, and we're trying to make sure that it addresses the major concerns of the poor. Now, we're also dealing with issues, obviously issues that have backed up over the years. And so it's obviously a huge challenge. And I think that the only way to gain the trust of the people is to incrementally do what you say you will do, and to achieve, and to make sure that we achieve those, and to be as transparent as possible with the people, which is what we're trying hard to do. Regarding diasporas and enabling environment, Professor Tomori said the problem is not the diasporans, it is home itself. You may be right, but the point really that I was making about the diaspora is that there are several persons who are in diaspora who are doing business in Nigeria and who are working very hard working very hard and cooperating with Nigeria, with Nigerian institutions and Nigerian businesses. That's another story. There are several, and I have so many examples. Now, it's not to say that the environment is perfect or that it has come to its own, there are challenges. There are several challenges. But I think the most important thing is to work at those challenges, which is exactly what we're doing. And to the point which was made, I think, by Kamal about registration of companies, last year, especially around that period, the August period, what happened, of course, you know that CAC is now, most of its services are online. But last year we experienced a major problem because most of the workforce of the CAC had to stay at home, and there was a glitch in the electronic portal and all that. So we had a few difficulties, and it wasn't just you, Kamal. There were a few other people who had complained, and you probably would appreciate that just before then, before COVID, the CAC was working at in top form. As a matter of fact, one of our major scores with the ease of doing business was with respect to what we're able to achieve with the CAC. Things are getting back on stream now, and I would certainly like you to be in touch on this issue of the difficulties you may be having. But we can. I don't think that this is. I don't think that this is pervasive at all. There are a lot of work is being done, especially with the CAC, and I certainly would like to see that this is resolved, because the CAC has been working very, very hard. I knew when they had a problem, but they are now at the point where they are trying to resolve those problems. I'll just quickly take the question, I think, on somebody suggested, I think it was Ronnie, who suggested that Nigeria's external debt is 87 billion. No, that's wrong. Actually, our external debt is 32 billion, not 87 billion. The most of our debt is domestic, right? So what it is that about 57%, of our, about 57 billion of our debt, or over 50 billion of that debt, is domestic debt. So, I mean, and frankly, 32 billion debt should not be a cause for panic for a country the size of Nigeria. Our debt to GDP ratio is still only 21% at this time. What we have an issue with, of course, is our debt to revenue. And I think that this obviously is the reason why we're working hard to improve revenues. We're working hard also to reduce interest payments by making sure that our loans are of longer tenure and of lower interest rates and all of that. And then generally trying to rebalance the relationship between our local and our foreign debts. But please do not imagine that we're $87 billion in external debt. That certainly isn't correct. It's about 32 billion. As I said, the majority of it, of our debt, is local. What the finance minister said to the questions around whether we're just going to float the currency, what the finance minister said is that payments to the federal allocation will use the NAFEX rate, which is market, right? But that is payments to the federal allocation account. The federal allocation account is the account where funds go, funds that are shared between the federal and the state governments. It is with respect to the federal allocation account that the Minister of Finance said that the NAFEX rate, which is the market rate, will be used. But we're at a point where, where we have, where we've always been in almost a managed exchange rate regime. But we, just as I said, we are moving closer and closer towards unifying the exchange rate, so that the difference between the exchange rate and market rate is narrowing practically every day. And we hope that we'll be able to achieve this in the not too distant future.
I think, if I may, Vice President Osinbajo, we would love to continue this discussion, the scale of Nigeria's ambition, the scale of the challenge, and how you've articulated how the COVID response can perhaps be a platform to drive and accelerate broader changes across the economy, the health, broadband connectivity, and achieving your ambitious SDG goals. I think you've made really clear. It's been a fantastic discussion, and we very much wanted to thank you so much for joining us, for sharing your insights. We would love to be doing this in person. We would love to be having you in person in Chatham House, and I hope the day will soon arrive when we can have that pleasure in due course. Let me just flag to everyone today, thank you for joining us. It's been really fascinating, wide-ranging discussion, and we very much hope that we'll be able to continue this discussion and debate and dialogue about not only Nigeria's future, but the broader continent's future again. So once again, thank you very much, Vice President Osinbajo. Thank you very much, Professor Yemi. And you've shown us all your knowledge and your learning, and you've shown great tolerance in my mucking up your name there. So thank you very much, Professor. Over.
You called me the name of someone else. Obasanjo was a former president.
I know. It was more than a Freudian slip. Well, Osinbajo, thank you once again. And thank you to everyone, and the very best of luck to you from Chatham House today. Thank you.
Thanks a lot. Thank you very much. Thank you, everyone.